Anybody want to comment on that?
Yeah, I don't like ignoring family members. I just did what I was told. I don't really do that. I promise, guys. I would never, ever do that.
So again, Elena was a Confederate. However, the other folks in the room, so Charge, I know that you did a great job with leadership and were very much aware of the situation and updating folks on the situation.
Well, to me, it's two kinds of languages. One is the medical speak and one is the patient family speak. So even though we were talking about some very complex words, respiratory failure and hypercapnia, hypoxia and such, I could still translate what is going on in real words so that the patient and or the family can understand. We're concerned about his breathing situation. We're trying to determine what's the problem by ruling out what might not be the problem. And we have a standard process that we're following through that. And ordinarily, I would be over on the other side of the bed talking to the family member much more.
Okay. So in the situation, when you have the charge, in this situation we didn't have a physician present, so the charge is really running this particular part of the simulation. For some mutual support, who else might have been able to chime in and help support that family member?
Well, while the charge nurse from ICU was actually the leader in the group, she was really handling what was going on. It probably should have been the unit charge nurse who was back there taking notes, because everybody else was very involved with what was going on, concentrating on the patient, and she was the one who was standing by the patient. So I think that she would be the one, by the family member, I'm sorry, thank you, would be the one that, you know, even just a touch, you know, this is what they're doing, this is why they're doing it, in the background would have helped.
Okay. And if ever you're in a situation like that where the charge nurse, for whatever reason, doesn't take that on, then making sure we do use some mutual support and maybe somebody else, you know, addressing that family member or asking the charge nurse to take on that responsibility. When it comes to handoff, the communication of the SBAR, when the team came in, tell me how you felt about that part of it.
I felt that when I received a report that I didn't get a recommendation piece, you know, what was going on, what did I need to do next. When I gave report, I did explain we were recommending the rapid response team because this is the findings that we saw. So the SBAR was there, it talked about the situation, background for the patient, the assessment of the patient, but in my report to me, the recommendation was missing, which I tried to put into my SBAR.
And I thought you did a really good job of that. From my observation, you did a complete SBAR when the team came in.
Right.
Leader, how'd you feel about?
Yes, she very clearly had each disease process and each intervention that was currently going on for the patient.
Okay. How about role identification? When you guys entered the room, I did hear Marianne say, I'm the charge nurse, I'm Marianne. I was called for the rapid response team. Yeah,
I think that just Marianne and I actually identified ourselves. I knew who respiratory was, I knew who the CA was, because of the clothes that they're wearing at our facility. We are now color-coded with our uniforms, so, but I don't always know everybody's name. And then when Gary came in as the radiology tech, he did a really great job in identifying himself.
That's good, good. And I know we're color-coded, and so that's good, but that doesn't necessarily, we still want to do that, even though sometimes it seems redundant, similar to the patient identification and going through all those 3 identifiers each time. It's important that each member of that team identify themselves when they come in. All right. For leadership, so let's talk about leadership. It's very important in emergency situations for that leadership piece to be strong. How did you guys feel about the leadership in this setting?
Well, I felt it was a clearly defined leader. The nurse told me what to do. She was well prepared. She knew what was going on. She was assessing the patient, so I felt it went really well.
Okay. Anybody else want to comment on leadership?
I agree.
I felt confident with the leadership of Marianne had when we came in there, because I know exactly what to do.
Okay.
Yeah, and I think the absence of the charge nurse really, you know, forced them to be, you know, I have to step up, I have to do this, I have to know what's going on, because nobody else is taking charge, and I think they both did a really good job.
One thing that I thought was, from my observation on the leadership piece that was really essential here was that the leader continuously updated you on the situation. So her thought processes were out loud, and that was really helpful to the group so that everybody knew at each moment, okay. It also gave an opportunity for folks to challenge what it was that she said. Did anybody notice the 2 challenge rule being used?
Yeah, one time when the respiratory therapist was doing the ABGs, she called back all of the information to make sure that we had the same information. And then when the radiology tech was in, we were both looking at the ID band at the same time, seeing the same information.
Okay.
Okay, but Maria caught me on the IV fluids. So my inclination is just to say out loud, well, turn the IV off. Well, that's not really what I meant. And she caught me. So that was good that she challenged me on that decision, because then she said, wait a minute, we don't want to turn this thing off. We got to keep a line. So let's go KVO.
Right. And I also felt like your response to her made it comfortable for her to challenge.
Because I appreciated that she caught me on that.
Absolutely.
So the leadership point, I did hear a lot of call out and check back, but there were a couple of times we didn't check back. Narcan, and I didn't hear any check back to say Narcan. And only when she said, give me the time when you Narcan getting. And there's another piece when you were giving order to draw the ABG, and there was no check back, but at the same time, this is human factor, then you added more orders. And that gave distraction and interruption, and she couldn't concentrate what she's doing while getting additional orders.
Yeah, so how did you feel about the ABG when I interrupted you?
I got confused, and then I turned around. When I was trying to remember exactly what you wanted me to order, and I just went with what you told me the first time. And I guess the callback, I forgot. I just wasn't really paying attention, and I just knew that I needed to get that ABG drawn fast so we can get it in there and get the results back.
Okay, so in the result, I had asked about a lactic acid. So the lactic acid result didn't come back. So why lactic acid is an important in our situation here is about sepsis. He had that possible gangrene going on in the leg, so we want to make sure we're not going into septic shock here, although his blood pressure that I kept clarifying with the CA, blood pressure was still good, but we want to see where we are on the lactic acid. But I was unfair in that I was interrupting you when you were trying to palpate the pulse.
Yeah, and I think I learned to, kind of stop, think, and make sure whatever procedure I'm getting ready to do, I'm clear about it and have a clear order before I attempt the procedure.
Right.
And well, that one other piece was with the Lasix. You just said, let's give Lasix without dose route, so that clarification was helpful.
Yeah. But did you feel comfortable in saying back to the leader? Would you feel comfortable, RT, if you said to me, wait a minute, repeat that again, what you want on this?
Next time.
Okay.
If it falls on me again, yeah, I would feel more comfortable than I did this time.
Okay.
Great. It is really common in emergency situations for people to be talking over top of each other, and that's really part of what leads back to some of those communication problems. And although sometimes it happens, we can help to mitigate that by using those call-outs and checkbacks, and also making the situation comfortable enough that somebody feels okay in doing so.
Well, I thought it was also good that the X-ray tech requested the assistance of the RN to make sure the patient was correctly aligned in bed, and so they supported each other in the team.
Yeah, as Judy said, that's a mutual support there being used too. So when counting how many times each of these events happened based on the team steps, you guys had hits galore out of the misses that we had found. So you did a really good job in all of those areas. Has anybody had experience in an emergency situation like this? Tell me what that was about, or did you see some of these being used or not being used?
Unfortunately, there's kind of some situations where you've got too many what we call looky-loos in the room, and that can be confusing because you just want to get them out of the room. And then there's some situations where, like if you're working at night or a small unit, and you might just have you and an RT. Mm-hmm. And so not only are you thinking about what you need to do, but you're also given the meds, and then you're trying to interact with the RT and make sure everybody's working in tandem. So sometimes it's bad to have too many and it's bad to have too few. But for our organization, I believe that the color coding of the uniforms has really, really helped us establish collegiality and I think a lot more respect for each other's disciplines, because everybody has such an important aspect in taking care of the patient in an emergency situation.
Yeah, and if I come in late and I see, you know, there's enough of the RTs are there or enough of the nurses are there, I can step back and I can find, you know, something else to manage on the unit and make sure everybody else is taken care of, or I can, if there's too few people, I can hop in and say, what can I do to help?
Well, and the other point of that too is if you see too much blue, too much red, too much gray, you could start taking people out of the room so that there's less confusion.
Yeah, that charge nurse should be directing traffic a little bit better.
Thank you for not, though. Has anybody else had any situations, emergency situations like that?
Well, I recently went to a community event and the same type of situation happened. It was actually a lot of people responded. So it was really not a clearly defined leader. So I think with the, you know, with the steps and the training we just received, the situation could have probably been a lot better.
All right. For the final scene, when we did the handoff to ICU, tell me how you felt like that went.
I thought it went pretty good. I was able to keep track of everything that was occurring during the event itself so that when I was able to give report, I was able to give a full report, and then with the charge nurse, ICU charge nurse's synopsis, that helped clarify everything in my mind so that I wouldn't forget any of the pieces. So personally, I felt I did a good job with that, hitting all the SBAR points.
Great. And is SBAR something you use regularly?
Yes, it is, in most of my communications, yeah.
Anybody else have any comments on the handoffs?
I thought her report off was really great considering the report that she got. So I think she did really well.
I thought she did too. She really wrapped up all those loose ends. All right. So does anybody have anything else they want to share about the overall simulation? Do you feel like this is something you can take back to your unit, something that you could use?
Well, there's definitely various aspects in this entire storyline that can be addressed at various different levels of learners. And so the storyline, even though we addressed it as a change in patient condition, this storyline can also be used from everything for breaking bad news, how to use universal protocol to prepare a patient for surgery. It can also be used for various disciplines to act on the patient in any one of those situations. So to me, it's a mixed methodology to focus on various different types of learners' needs.
So you found it valuable to your
Yes.
practice and something you could take back?
Yes.
I agree.
Okay. Well, I appreciate everybody's involvement and activity today. Just taking us back to those team steps didactic that we had covered, and giving you guys an opportunity to practice that during the simulation, as well as hopefully taking this back to your clinical practice and implementing these to help improve your patient outcomes. We're going to be sending out an evaluation. You should have it in your email inbox fairly soon to give us some feedback on the simulation that occurred just now. And then you'll receive another evaluation in about 3 months to ask you questions about how it's going in your clinical practice and are you using the techniques, and some feedback on how the training has impacted you. So I do appreciate all of your input, and we don't have anything else. I think we're all finished for today.
Thank you very much.
Thank you.
Thank you.